It is brand new research. Scientists are just starting to understand the effects of marijuana on the teenage brain. What they do know for sure is that the younger they start using it, the more it'll impact their development. And with legalization just over a month away, they have a warning for adolescents. Have either of you guys tried it before?
Oh yeah, many times. Of course, love it.
How old were you when the first time you tried it?
11.
11?
Yeah.
Wow. Starting as young as 11 may seem extreme, but the reality is that more youth are trying pot than ever before. Dr. Karen Leslie with Sick Kids says studies show 10 to 15,000 Ontario high school students smoke it on a daily basis.
That's a pretty concerning number in terms of it's not just experimental using once ever or once a year, it's using every day.
Concerning too is the certainty with which physicians say adolescents are more likely to become dependent on the drug.
We definitely know that certainly many young people that we see in our program who have been using cannabis daily, multiple times a day, absolutely talk about and share with us that they are dependent on it.
Because the frontal lobe of the brain continues to grow until most people are in their early to mid-20s, many clinical scientists are now focusing their cannabis studies on youth.
This is a very particular time frame in which it seems cannabis may be more deleterious or dangerous.
Given that, Dr. Romina Mizrahi says there's no doubt marijuana affects the development of the teenage brain.
Heavy use is significantly associated with increased risk of psychosis.
In her studies, she's noticed cannabis use leads to a reduction of dopamine, a neurochemical in the brain which plays a role in the motivational component of behavior. But she also found patients who experience psychosis have an increased level of dopamine in the brain, the results leaving her and her team confused.
So I can say we're puzzled. Certainly there is not nothing. We just don't know very much about it yet.
Okay. So to sum up, you know that it does affect development, but it's unclear exactly how.
That's right.
Physicians recommend waiting to try it until the age of 25, when the brain has fully developed. With legalization just over a month away, what warnings would you have for adolescents, or what concerns would you raise for parents?
So, I mean, I think that biggest piece is really that piece around kind of, there's a big difference between trying and becoming a more regular user, right? And so absolutely, the biggest message are less is better, right? The least you can use is best.
Physicians do note there's a huge difference between how recreational marijuana and medicinal marijuana affect youth, saying the latter can prove extremely beneficial for treating certain medical conditions. For City News, I'm Tina Yazdani.
Are you ready for this?
The Marijuana Files. Coverage continues daily on City News.